What's going on? Yadi, the Qigong therapist. Blip! I have on a white t-shirt. And this question was asked on Facebook. It's a question, what do I do for thyroid issues? Some people have been diagnosed with Hashimoto's or Graves' disease, which is thought of as hypo, meaning deficient thyroid. It's not producing its hormones, hypothyroidism. If someone has hyperthyroidism, that's usually like a goiter, and that's not too common because they found that iodine was the cure for a goiter. All right, so generally in our traditional medicine, the thyroid is thought of as having a direct relationship to all the endocrine glands and specifically the adrenals. If somebody has a thyroid issue, I can bet you that person also has a lot of fatigue. I can bet you that that person doesn't have a lot of energy, and they typically they're very sensitive and they have a whole lot of other imbalances. So if anything is wrong with the pineal gland, pituitary, thalamus, hypothalamus, thyroid, parathyroid, thymus, pancreas, adrenals, or gonads, ovaries, testes, if something is wrong anywhere, you're going to have a problem secreting these natural hormones, especially in the thyroid. Now, when people diagnose you with Graves' disease or Hashimoto's, and you accept this as the bottom line, and you don't pursue a natural way of balancing your entire endocrine system and you just target the thyroid, you're going to make a lot of mistakes because I'm positive that this is not the only imbalance in your body. Rome was not built in a day, nor was it destroyed in a day. Okay, there are a lot of causes for this, one of them being specifically kidney yin deficiency. If you want to know if you have kidney yin deficiency, you look under the eyes and you'll see that I have darkness under the eyes, but I don't have sunken dark eyes, nor are they puffy. If they were sunken in, that would mean I had more yin deficiency. Okay? If they were puffy, that would mean I had kidney yang deficiency. That's just a way of reading the face. For some of you ladies that wear makeup, you can't really tell. I'm not wearing makeup ever. But, okay, so what we're going to target mostly for thyroid is the adrenals. And I have a program specifically for that. I have a program called Male Sexual Qigong and Female Sexual Qigong, which is about boosting the Jing, the essence, the kidney energy, both yin and yang, okay, which will indirectly target the thyroid. Now, again, if somebody wants a quick fix remedy for the thyroid, I will tell you there are points that represent your thyroid. Let's say in Tibetan medicine, it's pericardium 6. A lot of people know this point. It's called Neguan or inner gate. You can find it if you locate this little line here where the hand ends and the wrist begins, and there are two tendons, sort of like a valley in between the two tendons. You just take 3 fingers, put them down in that valley from this point in the wrist at the line, and at the third finger, you push in, should be mighty sensitive, right? This point has a lot of other functions, but it represents this area in Tibetan Bonpo medicine. A lot of people who do Tibetan arts, they know things to be chakras. Well, this represents a chakra. A chakra is probably another word for an endocrine gland as we know it. Okay, so if you got thyroid issues and they're acting up, you can push in this point. That's not a cure. That's not a diagnosis. That's not a treatment. The treatment is to get your endocrine system firing in correct order. And that is best accomplished through good sleep, good water, a good exercise program, and probably a great manual therapy like reflexology or acupuncture, Choi Na, or any of the old Oriental Marma, Bampo, any of these great things. This is Yadi Alamin. These are some of the things that I would say about thyroid issues. Okay, so stay tuned, be well, and stay well. We'll talk soon.